All right, welcome everybody to the March meeting of the Radnor Township Board of Health. We are going to start off with organizational issues, beginning with recognition of health-related dates and milestones. Very quickly, one that was not on here but that was brought to my attention since then is that this is, in addition to the things that we listed, Brain Injury Awareness Month. It is also the 1-year anniversary of the plastic bag ban being active in Radnor. So I did a little back of the envelope math. If we assume that the average Radnor resident used just 3 plastic bags per week, based on the last census count of 33,228 residents, then over the last year, we saved over 5 million plastic bags, which would have reduced our carbon footprint by roughly the same amount as if our town had collectively reduced our driving by over 166,000 miles in the last year. So that's pretty great. This is also the 22nd National LGBTQ Health Awareness Week, which of course we also have a presentation after our board business meeting related to that. This is also MS Awareness Month, and it's a disease that a lot of research is still being done on in terms of the causes and cures and prevention, so it's definitely something to still be aware of. And then I did also put a note on here about daylight savings time because around this time last year, the House of Representatives made a big splash by voting to get rid of daylight savings time, and for whatever reason, the United States Senate has decided not to do anything about that. So for anybody who there was any confusion, I actually heard some people saying they thought that it wasn't happening this year. It is still happening. Both, we have a bicameral legislature. Both houses need to pass it in order for, you can go back and watch Schoolhouse Rock, how a bill becomes a law. But right now we still have daylight savings time. Very quick update on, so I know we had some discussion last time about the meeting dates and times, as well as some potential hybrid changes. We had a few members who were not here, so I wanted to get their feedback before we kind of did anything official. But basically where I think we landed is that there is not really consensus on a date to switch to, and but there was consensus on making the meetings hybrid going forward. So so that's, I think, what we're going to do is starting with April, we're just going to have all of the meetings be hybrid going forward. I'm still going to recommend that unless anybody is, sick or truly not able to come, that everybody try to come in person to facilitate the meetings as best as we can. As far as changing from the Monday meetings, there were some for and some against, so where I'm just going to leave that at is, I know we don't vote on things other than the minutes that often, but we can, if anybody wants to make a motion for one of those particular other days that we had listed, we can always take a vote on it, but that's kind of where I'm going to leave that. With that, does anybody have anything else under organizational issues? All right, so then.
Alex?
Oh, yes, David?
I am on the meeting, but I can't see the meeting room, and I can only see tiles with myself and Ian. I think Ian must be set as the speaker or something because I can't see the room. So that's an organizational issue for me. But if you see Ian, can you let him know that that there is no camera view of
Ian's listening, so I'm sure he just heard you, and I'm sure he's working on it.
Thank you.
So with that, we will move on to review and approval of minutes. Does anybody have any comments or notes about the minutes from the last meeting? All right, can I get a motion to approve?
Motion to approve.
And is there a second?
Second.
All right, so that was a motion by Lisa and a second by Drew. All in favor? Aye.
Aye.
All right, motion passes unanimously. Moving on to reports. The report that we initially had scheduled from CSU, I just got a note from Chief Flanagan earlier that they would like to move that, so we're not going to have that tonight. So with that, we can move on to our report from our school board liaison. Yep. Paniota.
I was actually bringing it up. Well, first, I am very excited to announce that the Radnor Middle School held their annual mini-thon. I'm sure all of you are familiar with that.
Stand by.
Yeah, that is. Okay, let's start that again. So Radnor Middle School held their annual mini-thon last Friday. It is always a wonderful event. Was started 7 years ago by one of our middle school students who is now a freshman. No, I'm sorry. Yes, a freshman in college this year. So it is always lovely to see. They were able to raise $147,593. I'm sorry, $147,593. So that is very exciting. That's a huge amount of money, and that will go to help children that are, truly in need of that. As far as the schools, they're seeing very similar things. Lots of GI viruses, some little bit of COVID, sore throats, flu and conjunctivitis or pink eye still appear to be big things. And our nurse wanted us to let you know that there have been 2 cases of pertussis at one of the private schools. So just something to keep in mind. And that's really it.
All right. Well, as long as there are 2 cases of pertussis, I'll just take a moment to remind everyone in the community who's watching that that is a vaccine-preventable disease. So please consult with your physician, of course, but definitely vaccination is encouraged. Before we totally move on from the school board, I will just also mention, because of course in Radnor we love having well-rounded students, so I did want to give plaudits to our very own Finn Ryan, one of our Board of Health interns, who had a very great performance in the high school production of Chicago over the weekend, as well as Lisa's daughters did as well. So just want to congratulate them on that. I know that's a big milestone for the seniors, is their final year in the musical. So congratulations, Finn. And with that, does anybody else have anything related to the schools? All right, so then we will move on to our report from the Board of Commissioners liaison.
Well, I don't have much to report this week. I was just going to touch that the community support unit that you were referring to earlier is up and active. Fox News just did a positive story on it, so that's pretty exciting. And we're doing a lot of land use development at the Board of Commissioners that doesn't have a whole lot of pertinence here. So that's it.
All right. With that, we will move on to Delaware County. I did not get a chance to go through the reports for February yet, so next month I will present 2 months' worth of reports. I will just remind everybody of one significant change from the food inspections, which is that Samantha Cooper, who had been assigned to Radnor, has since been promoted to a supervisor position. So now she's going to be overseeing the health inspectors for the county, and we're going to have a rotating group that's going to be doing the health inspections from now on. So congratulations to Samantha. We keep getting people here in Radnor that keep getting promoted on up at county. So we're grateful that they keep assigning the good ones to us. Some other updates from the county for the rest of this month, which is also National Nutrition Month, in addition to the other milestones we marked earlier. Every Wednesday for the rest of this month, they're doing cooking classes at the Chester office, focused on lowering blood sugar for people who are diabetic or pre-diabetic. There is one on 320 from 11 a.m. to 1 p.m. and one on 327 from 5 p.m. to 7 p.m. On 321, which is a Thursday, there is also the Strollin' Colon Education event, sponsored by Jefferson Health, and that will feature, among other things, an inflatable colon exhibit. So that's going to be at the Media Courthouse. I don't know what the inflatable colon exhibit entails, but it sounds interesting and educational. So that, again, is Thursday, 321 from 11 to 2. The second annual Chester Women's Health Conference is also this Saturday. That is 323 from 9 a.m. to 12 p.m. at St. Luke at 320 Tillman Street in Chester. Registration is required for that event. And then Wednesday, April 3rd from 12 to 2 is the Penn State Brandywine Health and Wellness event. That event didn't have that many details on it on the calendar, so I think there's more to come on that one. Marie, anything else I should announce while you're here? No? Okay. So a couple of things I wanted to make people aware of from Radnor Fire Company. Call volume stats from Radnor Fire Company showed 878 fire calls in 2023. That's up from 811 in 2022, which is an 8% increase and represents the highest number during the 10 years that data are available. EMS calls in 2023 were at 2,510, which is a drop from 2,699 in 2022. That's a 7% drop, but it still represents the second highest number in the past 10 years. That's data that's available on the Radnor Fire Company's website, but I thought that that would be useful for the community to be aware of. Also, while I was on the Radnor Fire Company's website, I saw two other things that I think are relevant to what our board does and that I'd like to make people more aware of. They help you do car seat installations. That's not something that I was aware of, but there's a form online. You can fill it out. I guess if you're a first-time parent and you've never installed a car seat before and you want to make sure you have it right, the Radnor Fire Company will actually help you do that, which is a great service for them to be offering to the community. They also have something called Pulse Point, where you can register the location of defibrillators. So if you go on and you can see a map of, I guess there are certain businesses that have them. Like I could see on the map, there's a Target near me that has one. So that's something to be aware of, because I guess when people respond to those kinds of calls, they will check a database that takes a look at where those defibrillators are located. So everybody please be aware of that, and please keep that up to date if you have defibrillators. Again, that's called Pulse Point, and it's on the Radnor Fire Company's website. Moving on to presentations and programs, we'll start with the student internship program. And before we go on to Chloe and Finn, believe it or not, it is already time to start thinking about, for our board members, presentations and topics for next year, because we did say that we wanted to start trying to get on a cycle of putting the proposals out there before we go on our summer break in June. So with the schedule that we had set up, it is already time to start thinking about that. And next month in April will be time to pitch any topics that anybody thinks they might want to work with a student on for the subsequent school year. And with that, we can move on to Lisa and Chloe and Finn.
Finn, do you want to give an update?
So I've continued my assessment of bike availability and other services regarding that. So far, I've done 2 assessments, just driving around the area from like Wayne Square to the area by the train station, and then down to the area by the White Dog and the Wawa. And moving forward, I will likely do one more, expanding it a little more. Obviously, going into like the more residential areas doesn't do very much because there aren't bike racks there, or there aren't bike racks that would be of concern to us. But possibly further into town might be a next step. But with the information I've already received, I've created a map that can be made public, but right now it's just kind of for my own research. It's like color coded by the different types of racks. There are ones that are like single racks, more ones that the most common one I believe is double. But what I've noticed is that really beyond the very public areas that you would expect to have these racks, like the library or the high school, or high school wasn't in it, but the middle school, there really isn't much. There's one on East Lancaster Avenue, which is a single, and then there's one by the Rite Aid. But beyond those and the ones by like St. Catherine's, there isn't very much available to people in the town. So that will be definitely a part of my presentation. And we've met just recently, actually, and kind of went over the presentation format and what might be included in that.
So our plan, and I assume for the other intern as well, is for presentations to be in May, because June, then we're getting into, I think, either week of graduation or the week after graduation, when a lot of kids are out and about enjoying graduation.
Chloe, do you want to tell us what you've been up to?
So after our last Board of Health meeting, I met with the curriculum committee on March 5th, and that's where I presented my research, and they approved it at that level. They said everything looked good and clear. So then they pushed it up to the regular board meeting, which is, I think, meeting tomorrow, and that's where they'll vote to officially approve my survey. And after spring break, like most likely the first week of April, I plan to send out the survey on Schoology, which is the platform where most students can access the survey. And I'll probably have it during a required extended homeroom, just so I can have the maximum amount of people possible to take my survey. And then probably by mid-April, I will be able to collect the data and start my presentation.
Well, I also just want to very quickly congratulate you, Chloe, because Lisa, you know our struggle we have had in the past with getting surveys through, so well done on that one.
And PT, I'm sure you had a role in that, so thank you very much.
Yes, thank you, Panayot. Okay, and with that, the next, anything else on student internship program? All right. With that, our next agenda item is, under presentations and programs, is the oral health program. Bob's not here, so I think we're just going to skip past that one for tonight. The National LGBTQ Health Awareness Week presentation is obviously tonight as well, so we don't really need to have any extra discussion about that. Just a reminder that that starts at 6:30. That is a separate event from our regular board business meeting, so that will start at 6:30 tonight. We have a presentation on the schedule for after our next meeting in April. That is April 15th, Monday. Again, that'll be at 6:30. We don't have to necessarily schedule these for after our meetings. It's just worked out that that's the way the schedule has worked out and that's convenient for everybody. So that meeting is going to cover Stop the Bleed. They're going to go over Narcan use again, CPR, and just some other kind of first aid, first response topics like that I think are going to be very useful for the community. And then we're still working on a date for this one, but I did receive, I reached out with Louis DeSanto, who's a Radnor High School graduate class of 2012. He is currently the Regional Resource Director at Caron Treatment Centers and is also a speaker with Speaking Your Mind. We're still working on a date for him to present, but he saw the opioid event that we did, and I think he wants to add to that conversation as well. So we're very excited to have that. Does anybody else have any new proposals for presentations or anything that they wanted to announce or kind of put out into the ether at this time?
Alex, before you move on, I really couldn't hear what you said about Louis DeSanto.
Oh.
So if you repeat that for me.
Sure. So he's a Radnor High School graduate class of 2012. He reached out to me after we did the presentation in January, and he is the Regional Resource Director at Caron Treatment Centers, which already partners with our Radnor High School on some of the services that they offer. And then he's also a speaker with Minding Your Mind and has done speaking about recovery from addiction and things like that. So he and I actually have an appointment later this week to kind of flesh out a date and some more presentation specifics, but that's another one that we have going.
Great, thank you.
And actually, sorry, there's one more which I didn't put on the agenda just because it's so far off, but we already received interest in an autism awareness speaker who is already booked up for this April, which is Autism Awareness Month, but already wants to start talking about doing something next April in 2025. For anybody who has ever, if you ever have a chance to see or hear a presentation from Ben Hartranft or any member of the Hartranft family, they work with the Eagles Autism Foundation. He's a great speaker. He's been on Ellen. He is one of the friendliest people you'll ever meet. And he coined the term Benergy long before Ryan Gosling ever had Kenergy. So if anybody gets a chance to see him somewhere else this April, he unfortunately will not be here this April, but we are, we're getting popular. We already have people who want to book us into next year. So with that, we will,
Alex.
oh, go ahead,
Sorry,
Seth.
quick question. The process for identifying topics for our student interns for next year, could you comment on that?
I think the best way to do that is probably if people want to email me if they have any ideas, so that way we can put on the agenda what the different things are that we're going to be discussing, so that when we discuss them, people know sort of what the list is ahead of time. But we can also just, if anybody thinks of anything last minute or however it works out, if people, I was just going to set some time aside on the agenda during the internship discussion next month for people to pitch topics that they may want to present. So with that, we can move on to discussion of community infectious disease. David?
Let me start by doing something that nobody who speaks in front of other people should ever do, and apologize for the fact that I may be a little discombobulated. My brain's a little foggy as a consequence of my current pretty intense and acute COVID. But Alex has already raised vaccination. He's already raised autism, and in an email to me forwarded an article about the now nationwide outbreaks of measles, all of which are really critically important topics for infectious diseases. let me go through the roll call first. PT's update on what's going on in the schools is pretty much a great update for what's going on in terms of community infectious diseases. The COVID peaked in January. It's decreasing, but I'm evidence of the fact that we're endemicized and no longer pandemic or even epidemic, but endemic when it comes to COVID. RSV really doesn't need to be part of the discussion. Pertussis is percolating up. There's no clear peak to discuss there. However, we are in mid of March. The late influenza peaks tend to be influenza B. So far, all of the influenza out there has been influenza A, and there has been talk that influenza B has been nearly eradicated. But I'd rather wait until May to claim that victory, and I would assert that there is still a risk for a late peak, and those of us who got vaccinated in the fall are now at the waning edge of our acquired immunity. So I guess that leads into the topic of vaccination. And this cannot help but be politically fraught because a consequence of decades of poor information and misinformation, just the word vaccination prompts all kinds of reactions from all kinds of folks. And that's unfortunate because being anti-vaccine is like being anti-medication or anti-doctor or anti-science. I mean, if you're anti-science, you should throw away your cell phones and never fly again because it's science and engineering that brought you those things. All vaccines have the potential to hurt you. So it is certainly possible for anybody who wants to have an agenda against vaccines to cull information to suggest that this vaccine or the other vaccine might be harmful to you. They all can be harmful to you. Anything that you put in your body can be harmful to you. Vaccines have been developed for particular purposes. That is to say, to protect people from the severity of illness imposed by a wide array of infectious diseases to which we are all susceptible by living in a society where we have contact with other people, animals, and environmental factors. And they're tested through scientific principles for the purposes of preventing severity in the diseases in which they are found, and when used in the populations for which they are recommended to prevent those diseases, have proven to have a substantial benefit above and beyond the harm that they cause in those populations. So to move on to the one area where we can link those two, the most studied vaccine in the history of vaccines is probably the measles vaccine. That's a consequence of the fact that several decades ago, at a time when autism was on incredible rise in our population, and autism is a devastating problem for families that deal with severe autism, and it is unexplained. And its peak occurs in a population of individuals who are most likely to be receiving vaccinations, except for folks my age. And so there's an overlap of a high incidence onset of an unexplained disease and of recommendation for vaccination for a disease that we have now had, I should say, now all but eliminated. There was an immense kerfuffle in the literature caused by a paper that has since been retracted. All of the serious scientists on the paper have retracted the paper. The individual who was the lead author on the paper has not retracted it, but has lost his position as an academic researcher. And the paper tried to make a link between the measles vaccine and autism. As a consequence, in the 2 decades that follow, an immense amount of intense and highly qualified research has been done, a lot of it led by Paul Offit at our own Children's Hospital of Philadelphia, to completely dismantle any relationship between the measles vaccine and autism. So if you don't want to believe in science, you can hold on to that hypothesis, but there is no discernible scientific link between the measles vaccine and autism. And as a consequence, however, of this seeping into the popular way of thinking, the amount of measles vaccination has dropped from what was once 95% to some areas where it's below 90%. And in some of those areas, there are also people like the Secretary of Health or the lead health authority in the state of Florida, who said that people do not need to quarantine their children when they have measles. That it is pure insanity. Measles is, at one end of the spectrum, the most infectious virus that we really know in terms of the probability of acquiring the infection if you're exposed to the air of an infected individual is immensely high. And on the other end of the spectrum, it's a little like some of the more infectious coronaviruses, except more infectious. The benefit for us is that measles has not mutated at all. It's the same virus that it was when the measles vaccines were originally developed, and the measles vaccines proved incredibly effective at nearly obliterating measles from the landscape. And one of the problems we have is that the last time there was widespread measles was decades ago. And so some of the people who are parents of children are children of parents who haven't even seen the devastating effects that measles can have. And it includes brain damage and death for young people. So just warn people that those who should be vaccinated, get your measles vaccines. I don't want to go into the details of what the recommendations are. If you're an old guy like me, you have acquired lifelong immunity from measles by having had it. If you were born in the late 50s probably through the 80s, you were probably vaccinated by a program, and since then there has been some drop-off. To acquire herd immunity for measles requires greater than 95% vaccination in the population. And if your children are exposed, you need to keep an eye on them. If they have measles, they should be quarantined for 21 days. I don't know what else to say. I'm sorry if I've offended anybody who has strongly held beliefs about vaccines, but those are beliefs. I have to rely on the science as a physician and as a member of the Public Health Board for the Township of Radnor, and stay with the science. So I'll let go of you with the end of that rant. Thank you, Alex.
Thank you, David. I also just want to emphasize one of the things David touched on, which was the news reporting about the measles. So first of all, there have already been over 60 cases of the measles so far this year, which is already more than all of last year. And what David was referring to in Florida with the Surgeon General there, the CDC recommendation for people to stay home if they've been exposed to the measles and they're not vaccinated is a very, very long-standing recommendation. And I understand that there are people who have thoughts, opinions, questions about decisions that were made during COVID when there was a disease that was new and novel. And I think some of that is fair, some of it is maybe not, but I think some is. The measles has been around a long time and is pretty well understood, and the recommendations are very long-standing. And I just think that what happened there was irresponsible to tell parents that they could send their children into schools if they had been exposed to measles and were unvaccinated. I mean, I actually would say that it's a travel concern for anybody who is immunocompromised at least, or if they can't get, if they like actually have a real medical reason why they can't get a measles vaccine. I thought that was incredibly concerning.
Alex, incredibly concerning to the point of malpractice.
Yeah.
For a medical individual to recommend that it is okay to send people to school, and as you point out, there's no disease for which the relationship between the disease and the vaccination and the spread of the disease is better studied than measles.
Does anybody have anything else on the topic of infectious disease?
Speaking of vaccines, but vaccines for pets, there were 2 cases of rabies in the township, Skunk Hollow, 2 raccoons, I believe. So the dogs who had come into contact with those rabid animals had been vaccinated and basically were just followed. So just important reminder to get pets vaccinated.
Thank you, Lisa. Anything else on the topic of infectious disease? All right. So with that, we're going to move on to, we had a request from Commissioner Riley, and I put this on the agenda for last time, but we kind of just ran out of time, but was to discuss issues related to water quality, specifically related to a article on Radnor Patch from 2019. I have looked into the organization that that article was about, and they have more recent data that's available from 2021. So it's a group called the Environmental Working Group, and they have identified, not just in Radnor, but in many places across the country, what they believe are safe levels of certain contaminants in drinking water, which, according to them, are oftentimes orders of magnitude lower than what the government says the safe levels really are. So as an example, according to the EWG, they say that a safe level of arsenic is 0.004 parts per billion, whereas the legal limit is 10 parts per billion. For anybody who doesn't have their calculator in front of them, that's 2,500 times more that the government is saying is legal versus what this organization believes is actually safe. They also test for chemicals like trichloropropane, which have no legal limits. What they found in 2021 was that Aqua PA, which is the water supplier that Radnor residents get, is they have 16 contaminants that they've identified that exceed the EWG's guidelines. In terms of what this means for us here in Radnor and how people should keep their own families safe, the gold standard for water filters at this time is a reverse osmosis water filter. Those are the water filters that scientists generally agree are the best. They filter out the most things. I have one at my home. They work pretty quickly. Longer term, I think there's obviously a greater concern about, what needs to happen so that, rather than everybody buying their own water filter, the water we get is just properly filtered when it comes out of the faucet. That really goes beyond the scope of what our board is able to do, but it certainly in terms of as an item of interest to public discussion, I appreciate Commissioner Riley for sending that over to me. And I'm sure that if there are any updates to that at any point, we'd be happy to discuss it again, or if something with the sewer commission comes up that relates to health matters, I'm sure that's something we'd be happy to discuss in public again, but that's sort of as much as I was able to kind of find out about that topic. Does anybody have anything else on the water safety topic?
Yeah, Alex.
Go ahead.
The problem is that neither the government standards or the more rigorous standards that are proposed can actually be rigorously defended, because it's not like vaccines, for example, where you can take a population and test it. Many of the contaminants, the mechanism by which they might cause adverse health, are speculative. That doesn't mean we want them in our water, but how you make a direct link between a chosen level and the cost of getting to that chosen level is really difficult. And I think you're 100% correct. It's well beyond the purview of this board, but I wonder, and I'll talk to you offline if you'd like about this, whether we couldn't possibly put together a panel for the purposes of the township that would be educational with regard to where are we where we'd like to be, and what do we do in the meantime, so that people can feel safer about it. So you and I maybe should talk offline about what we might be able to do about that.
All right. Anybody have anything else on the water safety topic? All right. So I did want to give a quick update from Savage Sisters, who presented to us back in January on the opioid topic. Their landlord has decided that they are not going to renew their lease, and they have decided that they are going to go into some mobile van units, I believe. I just wanted to express that we were very grateful for the presentation that they gave to our board and for the work that they did here. And that I don't know exactly what is going on there, but that I certainly appreciate the harm reduction efforts that they are making, and that I think there's already been some interest in them coming back and presenting again, and we would certainly welcome them back if indeed they wanted to come back and present again.
I just wanted to comment that I agree with Alex that it is a shame that their harm reduction efforts and specifically their first aid and their wound care has really been paramount, and that's really a shame that has to be disrupted. But I feel hopeful that the mobile unit allows them the ability to actually go from need to needed area within the city. So that's maybe a blessing in disguise. And I did appreciate absolutely them coming here and all the information. I'm really happy to hear that we could have them back in the future.
I'd second that, and I would also add that outside of Savage Sister, the part of the city that they focused at, and their presentation was full of energy and content and highly appreciated. And the part of the city on which they focused is the direct focus, the publicly stated and repeatedly stated direct focus of the new mayor of the city of Philadelphia, Sherelle Parker, who has committed to cleaning up that part of the city, which is known worldwide as a massive shooting gallery.
Anything else on that topic from anybody? So I did also want to make an announcement. Chief Flanagan asked me to make this announcement, and I think this is actually really great news. There's a link in the agenda for anybody who wants to find the exact information for this, but the state of Pennsylvania has started a program where individuals who have a permanent residence in Pennsylvania and obtain either one or any combination of 4 state certifications related to EMS are eligible to have a portion of their tuition for those courses reimbursed, which is fantastic because we want people to be taking those courses and being certified. There are 4 different levels, so it also applies to people who want to take the course to get up to the next level. They can have their tuition reimbursed. Additionally, Pennsylvania licensed EMS agencies are eligible to receive reimbursement of expenses related to recruitment or retention, which again is great because that's something we want. We want our EMS providers to be able to recruit and retain their talent. It's an absolutely vital source to the community. So this is a great opportunity, and I want to emphasize that the funds for these reimbursements are limited and will be handed out on a first-come, first-served basis. So for anybody who that's of any interest to, whether you're obtaining your first EMS certification or you already have one and you want to obtain the next level up, That's definitely something to take a look at doing sooner rather than later, because these reimbursement funds are, as I said, limited, and they are first come, first serve. Did anybody have any questions about that? All right. Well, again, I want to thank Chief Flanagan for bringing that to my attention. I think that's it's a great resource. The EMS providers in many cases are already working on a volunteer basis, so anything that we can do or the state can do to help them with those costs is definitely very much appreciated. Oh, go ahead, David.
I think that should be highlighted as an example of your state government at work for you. And that we should be grateful. Elections have consequences, and we should be grateful to our elected state representative who put a significant amount of her energy behind those efforts. Lisa Borowski it seems to have been instrumental in helping to move that along. And so, thanks to our state government.
All right. So there is one other thing I wanted to bring up under new business, and I didn't put it on the agenda yet. I did run this by Lisa B., Kiki, who's in the schools, and then also Julie, our other mental health expert on the board who's not here tonight, which was specifically related to the media coverage surrounding what I thought was a very tragic event that was in some corners reported in a kind of heroic or celebratory way that I just did not think was appropriate at all, which was a suicide of a soldier who stated that it was related to world events that he wanted to try to make a difference on. I don't want to comment too much on the specifics because I'm not trying to discredit his political beliefs or give credence to them either way. I just think that, we have some leaders in this community, including some in media spaces, and for those people, I would like them to get the message that some of the coverage around this, I just was very uncomfortable with in terms of some YouTubers who covered it made videos where they called this person a hero or where they, really kind of celebrated it. And all I could think was, oh my goodness, what if there was, a student, at Radnor or one of the other schools or even one of the colleges who saw that and said, oh, well, maybe my favorite YouTuber will, make a hero video for me if I do this. And I really think that needs to be criticized and called out as being an irresponsible way to cover the topic. Whatever you think about the political beliefs that this soldier expressed in the video before he killed himself, suicide is not going to change geopolitics in that way. It is not. There are other ways of making a political point that don't involve ending your life or leaving your friends and family without their loved ones. So I strongly, strongly encourage anybody who saw that and thought that was anything to be emulated to reconsider, especially if they're if they're somebody who has millions of followers and put out to their followers that they think that is anything to be emulated. I strongly encourage them to reconsider that, and strongly encourage any, for however many students or parents who are listening, to please have those discussions. That is not the way to make a political point. Your loved ones would not want you to copy that. And I don't know, Lisa or Kiki, if either of you wanted to add to that at all.
I mean, I just appreciate you being willing to bring that up. I know it's a sensitive topic, and I think that a lot of times people are afraid to talk about suicides because they fear that maybe they're contagious, or maybe just by talking about it, it might unintentionally encourage someone or push someone, and that is not the case. And I agree, as parents, we all have responsibility to be overseeing as much as we can, for our younger kids, having some boundaries around social media and things like that. And for our older kids, trying to keep an open line of communication and sharing and being able to access different resources to help. So thanks for bringing that up.
I'd like to also emphasize that I appreciate your bringing that up, and I think the more we talk about that, the more we can get the message out that there has to be responsibility in reporting, and we need to be extremely careful in not sensationalizing tragic events because we don't know the state of mind of people who are watching. And as parents and community members, we need to stay open and discussing that suicide and self-harm is never a solution for any social or personal or any other issue. That talking is the way to start that, in a conversation. So thank you, Alex.
Yes, definitely talking is the solution there. Talk to your family, talk to your loved ones. The National Suicide Hotline number is 988. I definitely want to mention that. I was seeing some of the coverage on this, and in fact, some of the, mostly this is not mainstream media that I'm talking about that was doing this, but some of these YouTube people that were doing this have like millions of followers, and were actually criticizing news organizations that put the suicide hotline number on there because they felt that that was, demeaning to this person's political beliefs. And again, I don't, want to cast their political beliefs in either positive or negative terms. I just want to emphasize that that suicide is not a solution to any problem, and certainly not any problem as complex as geopolitics. So, I thank you. But does anybody else want to say anything about this topic before we? Because that's really our last thing before public comment.
Alex?
Yes.
I think it would make a great seminar in your series. Not necessarily this event, but suicide prevention in general.
All right, that's certainly something that we will consider. With that, we will open the floor up to public comment. I see some people are starting to filter in for the speaker series event afterwards. I just want to emphasize this public comment is for Radnor Township residents related to the Board of Health matters. If you have questions or anything related to that for the presentation, there will be time for that during the presentation itself. But are there any Radnor residents who have public comment that they would like to make at this time? All right, and with that, we will move on to adjournment. I'm going to say that we will reconvene for the presentation at 6:35, just to give any board members who need a little break. For anybody who is on the Zoom link, I think it's going to switch over to YouTube at this time just for security reasons. I think because we're not having any participation on the Zoom link, we want to shut the Zoom link down if we don't need it. And with that, I will take a motion to adjourn.
Motion to adjourn?
All right, and is there a second?
Second.
All right, all in favor? Aye. All right, motion passes. Meeting is adjourned.